Hi guys, I'm Cory Miller. I'm an obstetrician gynecologist, works for BJC Medical Group out of Progress West Hospital, and wanted to take a little bit of time to talk to you guys about the Well Woman exam. I kind of titled my talk the 5 W's of the Well Woman exam, just to give you an idea of what we do, what we're kind of looking for, what's happening with our visits, in order that you might understand a little bit more walking in what's going on, kind of lift the curtain a little bit and help you to understand. If you haven't had to come yet because of either you're young or behind, we'd be happy to see you, and we want to make sure that you kind of understand what to expect going in to maybe alleviate some of that anxiety. So, of course, our 5 W's, who, what, when, where, why. We'll skip the how because it's probably not as important. And some of those are pretty easy. So let's start off with the who. For your exam, there's going to be really 2 important people, and that's you and me, there for the visit. Now, you can have more people if you like. If it's more comfortable for you to bring a partner or a support person, of course, they're welcome. Sometimes they can be a good set of ears to hear what we're talking about, because it's hard to always hear what your doctor's saying and to understand exactly what's coming out. So having an extra set of ears can be nice. And then we usually have a nurse or an escort with us during your exam part, just to keep everyone safe and for liability reasons. But that's what you can kind of expect, is just the 3 to 4 of us in the room together talking. We keep it private and confidential. Who? What? What is a little bit more expansive? So what is a wellness exam? What's a well woman exam? We don't really call it your pap smear every year because that's not necessarily what we're doing. The pap smear is for cervical cancer screening for cancer of the opening or the mouth of the womb, a very specific kind of cancer. But there's lots of other things we want to talk about, including contraception, menopause, depending on your age, menstrual health, breast health, diet, exercise, smoking. So there's lots that goes into a wellness exam besides just the kind of dreaded pelvic exam part. So what's going to happen is you're going to get to come in, you're going to get to talk to us a little bit. We're going to sit down and have a chat, kind of build some relationship, get to talk together, have a chance to answer any questions early on, get to know each other a little bit before the more invasive part of the exam. Some of that's going to include going over your medical history and medications. Even if we've seen you before in the office, we like to make sure that we're keeping those things up to date. We're going to talk a little bit about some intimate things like your periods, like your sex life, maybe even ask you about drugs and alcohol, histories of STDs, history of births. We're going to get to talk about a little bit of everything. So just knowing coming in that that's all private and confidential, but it's going to be a part of your visit. From there, we get to do our exam part, and doing the exam means typically a head-to-toe exam, including listening to your heart and lungs, examining your neck, a breast exam, a belly exam, and then a pelvic exam that really should be fairly brief. For patients who need it, we will get your pap smear up to date. You might need STD screening if appropriate. We might even ask you to do some blood work if we need to be screening for other things like diabetes or anemia, kidney problems, liver problems, whatever kind of comes up in your visit that we need to be looking for. So there's a chance we might send you down for some blood work afterwards. How often do you need to come? This is a point of confusion for a lot of my patients because we've changed our pap smear guides lately. Our guidelines have changed so that young women in their 20s, really only need a pap smear every 3 years, and women over 30 every 5 years, as long as they have HPV testing. Now, that said, if there's a problem, obviously we need to see a little bit more frequently. And that's only for low-risk women who've never had problems with abnormal pap smears in the past. For women, though, as we kind of talked about in the what section, there's a lot that we're doing beyond just screening for cervical cancer. There's a lot of things that we're taking time with to talk about regarding your general wellness. So we like to see you every year. Part of that just keeps you on schedule so that when it is time for your PAP, you're not trying to remember, was that 2 years ago or 4 years ago that I was there? And so that we can talk about all these other sort of wellness parts of your visit. Where is pretty simple. It's at your doctor's office. We don't really make house calls for these anymore, and you probably don't want us doing that in your home anyway. So make an appointment, come on into your doctor's office to see us for your annual exam. And then the why part, in my mind, I think there are probably 3 reasons. We've covered them a little bit for why you come in for this exam. And those really come down to prevention, wellness, and relationship. And I think on the prevention side, you've got pap smear screening, maybe some blood work screening, some benefits from the pelvic exam and the clinical breast exam, ordering mammograms. There's lots of things that we do for preventative health. For wellness, a lot of times we'll spend some time talking about things like diet, exercise, smoking, things that we can do to improve your overall wellness. We even do some mental health. I have a lot of patients that I'm the primary prescriber for antidepressants or other medications related to that for. So that's wellness. And then relationship, I think, is important. Even in patients who don't need a pap smear, who don't need us to send off a cervical cancer screen that year, it's good to get to see you every year so that, heaven forbid, there is a problem down the line, we already kind of know each other. We know that whenever there's a gynecologic problem, it's a scary time. It can be frightening, and so it's good to have a relationship kind of built out already with your obstetrician gynecologist so that when you show up, we already know you. We've already seen each other many times, and it's a little less frightening, and we can really just focus on the problem instead of being nervous about meeting some new guy that's going to be talking to you about things that you maybe aren't quite ready to talk about with him, because we've already been over that all before. Those are really kind of my 5 W's of the wellness exam. If you're in need of scheduling one, call your OB. You can also see your family practitioner or your internal medicine doctor. A lot of them are glad to do your annual exam, including breast exams and pelvic exams for you. So it doesn't necessarily have to be a gynecologist. It can be a nurse practitioner. It can be a family practitioner or a general medicine doctor that can see about these things. But it's important that someone's doing your women's care and is thinking about you specifically as a woman and your specific health needs, and not just more general needs. So we appreciate your time. Thank you very much for your attention.